Our current healthcare model is broken, expensive, and is not changing the health of our society. Patients are suffering from chronic disease and body degeneration without options to escape. They are hopeless and broken. Welcome to HealthOvate with Dr. B. If you're ready to see how you can change your health for the better, you're ready to HealthOvate with Dr. B.
Hello, I'm Dr. Joel Baumgartner, which you can call me Dr. B. Welcome to the show. So how is healthcare broken, and what do we mean by HealthOvate? The current healthcare model aims to cover up symptoms with drugs, pain medications, damaging cortisone, surgery. The current system is super expensive with all the prescriptions, hospitalizations, procedures, and eventually surgery again. Our health insurance premiums, they're on the rise, but our health outcomes are decreasing. Spending on prescription medications in the United States will increase 4 to 7% by 2021, reaching $610 billion. 55% of Americans are on a prescription drug. 4.5 billion prescriptions are written per year, with 7 of the top 10 drugs written for medications that treat lifestyle, like hypertension, diabetes, cholesterol. The number one med is a pain medication. But I want to tell you what, there is hope. Hope that we can reverse your chronic disease through lifestyle changes, supplementation, and functional medicine. Functional medicine presents a new paradigm for medicine. Actually treat the root cause of the disease before prescriptions that only cover up the symptoms. It starts with a thorough investigation into the presenting symptom of the patient. A detailed history and physical exam is performed, followed by some targeted labs to figure out the root cause of the symptoms. Treatment first encompasses a person's mindset. Then we look at lifestyle interventions that could help restore more natural you. And finally, we use approaches using possibly prescriptions or other things that are going to restore you back to where you were before. I have helped thousands of people regain their lives through restoring their health and rebuilding their broken bodies. You have options in your healthcare. You do not have to live hopeless, in pain, tired, broken down, or degenerated. This is where Rejuv Medical was born, in a new model of healthcare. I created Rejuv to fill the gap in our broken healthcare system. We truly can regenerate our bodies. This first model restores lifestyles through fitness, nutrition, sleep, and stress management. Next, we rejuvenate health through functional medicine. Lastly, we rebuild bodies using regenerative treatments like PRP and stem cell procedures that focus on healing the body without cover-up medications or surgery. This triad has changed healthcare. It has innovated it. That is HealthOvation, combining innovative new approaches with healthcare. Together, we are all health changers. We are all HealthOvaters. And it's time to HealthOvate. Thank you. Thank you all for being here. This is going to be a very exciting show. We're going to talk about how to redefine healthcare. You know, when I go back in time, I remember my first job after my fellowship in non-surgical orthopedics. It was part primary care. I worked in this large system and I was seeing 20 to 30 patients a day. Unfortunately, my patients were on multiple medications that were just treating the symptoms but not addressing the root cause of the issue. You know what? I felt as hopeless as they did. Then my patient, Susan, who is also a nurse, introduced me to functional medicine as a means to get my regenerative patients better before we did their procedures. And it just was amazing. My outcomes were so much better after I got them functionally better. So functional medicine soon became a part of what Rejuv offered and became our third leg in our system to redefine healthcare with medical fitness along with regenerative orthopedics. We have patients that fly in from around the world to get regenerative treatments here like PRP, which is platelet-rich plasma, and stem cell procedures. In fact, yesterday I had a guy fly in 20 hours to see us from Guam. He's probably on a plane now flying back home, but he's starting to heal his knee. He didn't want a knee replacement, so we're going to help him out. We have about a 92% success rate, which is really good, and we've helped thousands of people avoid surgery, get off their narcotics, regain back their zest and vitality. You know, part of our success is that we look at the entire body and make sure that it's tuned up before a procedure. And then we continue those changes long afterwards as well. We are reversing chronic disease while at the same time regenerating their bodies. And that's where the topic of functional medicine starts. So what is it? And how can we help redefine healthcare and create true health and healing? Let's welcome our guest today and dive deeper into how this type of medicine is different and how it can provide hope to patients that are still broken and not treated by the current symptom-based model of care. I'd like to welcome Melissa and Lorelei. Melissa's a nurse practitioner who specializes in functional medicine, and Lorelei is a patient whose life has been changed after being treated with this restorative model of healthcare. Welcome, and thank you both for joining us today. Melissa, let's start with you. You are changing lives every day. I know you're passionate about what you do. You come to work with a smile on your face because you love going to work, and it's awesome. So I want to know, why did you decide to go into this style of medicine in the first place?
So I started nurse practitioner school and had the pleasure of being in a functional medicine clinic for a rotation. And while I was there, I was seeing amazing things. People were getting better very quickly. They were losing weight. They were feeling better. And I wanted to know more. So what I did is, at the time I was having acne, I was having seasonal allergies, I was constipated. And so I decided to put myself on a low glycemic index diet, which is low sugar. And guess what? Everything went away that I was struggling with when the Western medicine doctors I was seeing at the time weren't helping. So I was hooked at that point. I love the idea of working in a meaningful field where you can help people heal and not just treat them for disease.
Right, you're making some profound changes, I agree. And your skin looks good today too.
Thank you.
Tell us in the audience too a little bit more about what are some of the different problems that you see on a daily basis. What are people coming in to see you for?
Yeah, I think the biggest thing I see would be the challenge in losing weight, fatigue, stress, hypothyroidism, and gut issues.
Yeah. I agree. Fatigue. So many patients are coming in. They're fatigued. They're apathetic. They're inflamed. Their joints hurt, and it's not always. They don't always need a procedure by me. Sometimes all those symptoms, even headaches, there's something going on in their body that's causing them to be fatigued. I guarantee you, they don't need an antidepressant, which the current medical model is giving them. They need something to get to the root cause of why they're feeling that way. I totally agree with you. On that vein, why don't you tell me a little bit how is a functional medicine approach different than maybe a traditional medicine approach when it comes to figuring out the root cause?
Sure. Well, I think one, we're more investigative. I feel like we spend a little more time with our patients, and we're looking at the entire person. How is this system affecting this system and this system? So it's a little bit more in depth.
Right. Yeah. So it is amazing. So tell me a little bit more about that. So if I'm a primary care doctor, someone comes with fatigue and they spend 5 minutes, and they might say, okay, here's a prescription for that antidepressant. If I came with fatigue to you, what kind of a conversation would you have with me, and where would you go from there?
Sure. Well, I would want to know about your stress level. I would want to know about your diet. I'd want to know about how you're sleeping and how you're eating. I think all those things are really valuable. And then I'd want to know more about your gut health. Yeah,
so important, so important. Thank you so much for all the lives you're changing. I want to kind of talk now with you, Lorelei, because you have gone through this. You've had the old traditional model, but they figured out something about you that has really changed your life. So I want you to tell me what prompted you in the first place to go seek out a practitioner that practices functional medicine.
Sure. I had been pretty ill and very fatigued for about 6 months and been seeing my regular doctors. And my final straw with them, I left the office with a prescription for Zoloft and a prescription for Trazodone. And I thought, this can't be it. They treated me like it was all in my head, that I didn't have hives for real, I didn't have allergies, I didn't have gut health problems, fatigue, it was all in my head. I thought, there's got to be a better way. And that's what led me here.
All right, that's great. So when you went and they started investigating, what did they find out with this functional medicine model that the primary care model might have missed the first time?
Sure. Well, first of all, the primary care, they refused to test me for a lot of things that I felt would be worthwhile. They said they didn't feel like I had allergies. They didn't feel like I had these issues. And the first thing that happened here was they tested me, and they looked at my whole person. You know, what was I eating? How was I sleeping? I remember walking in here just feeling hopeless and maybe reservedly, optimistic, but pretty hopeless. And Val, the person I see, she sat down and she looked me right in the eye and said, "Lorelei, we're gonna find this. We're gonna test you, and we're gonna fix it." And it was life-changing. I had hope again for the first time in months. And she wasn't lying. She did all that. They tested me, found out I had hormone problems, low cortisol, heart problems, adrenal problems, tons of things wrong with me that no one had tested me before. before, and all fatigue causing. And I've been treated, and I'm still on my journey, but I feel really, really pretty well. Yeah.
You know, I really like that word hope, because I think this model does give people hope, and I agree with you. It's taking time to figure out what the problem is. All the other physicians out there, they could make such a difference as well, just taking a little bit extra time, diving deeper and asking those questions that get to the core root cause of it. So you had the hope, you made the changes, you're working on lifestyle changes. So tell me where you are today. How are you different than you were, say, a year ago?
Well, for example, a year ago, it took all of me to get up and go to work in the morning. And then when I wasn't working, I wanted to be on my couch in front of the TV, not doing anything, not helping my children, not being active in my church or community, not, you know, just trying to keep breathing. And there were mornings I'd wake up and go, oh, I woke up again. You know, just because every day was so exhausting. And now my sister's actually kind of upset with me because we used to spend a whole day watching TV together. I don't want to watch TV anymore. I'm too busy. I've got things to do. I'm active in my community. I'm active with my children. I feel wonderful, and how I treat other people has changed too because I feel wonderful. You know, I'm more patient with people and kind and loving, and it's changed my whole life.
I love it. That's like a chain reaction. So it's not just making your life better, but because you're a mom, you interact with your friends, you're making their lives better as well. You are a positive influence. You're spreading the light, and that's just amazing. A question I have for you too is your family. Do they know what you've done? Do they know why you've changed? And do you recommend this stuff for them as well?
Yeah, I'm pretty vocal about it. I'm not shy. I tell everybody who'll listen about my experience here, and actually give them phone numbers if I need to, or anything. And even if it's not here, any kind of functional medicine place. Traditional medicine is not the be-all, end-all. There are other options out there for you, and this is by far, in my opinion, the best option.
Right. And it's just, for me, it's a continuation of what medicine is already trying to do. Doctors went into medicine for a reason. We all want to be healers to change people's lives. But those that are getting more training and looking outside the box, I think, are the ones that are going to change healthcare, redefine it, and give outcomes like you. So that's just amazing. So thank you both for being here today. I really appreciate it. I think we've got a lot of nuggets, for our audience as well. So when we come back, I want to make the rounds. We're going to take some questions for you, the audience, and see what you might have on your mind. So stay tuned.
I've come to Rejuv to do a non-surgical procedure to take stem cells out and throw that into my knee and hopefully get some cartilage to regrow in my knee. You can actually see it go into your knee, and then there's a full, complete process that's happening, and that was really easy. Overall, it's been a good experience.
Rejuv Medical has changed the face of healthcare. Through nutrition, fitness, functional, and regenerative medicine, we eliminate pain and stop chronic diseases in their tracks. More at rejuvmedical.com.
Thank you so much. Welcome back. Today we're talking functional medicine. It's the new frontier in primary care. We're discussing how you can take an entirely different approach to healthcare. Let's make the rounds. Now it's your turn as the audience to ask some questions, so let's get to it. Anybody out there have a question? Yes, back row.
I've heard a lot about gut health, and I'm wondering if you can talk about the issues related to gut health, and if a person's having issues with their gut, what can you suggest they do?
Okay, a great question. Melissa, you want to talk about gut health?
I'd love to. So the first things I talk about my patients with in regards to gut health, but I want to know a few things about your bowels. So I want to know, are you having acid reflux? Are you having diarrhea or constipation? Are you having more gas than other people? Or do you feel bloated after you eat? All those things can help me to understand if there's something going on. And then what we do from there is we want to think about the causes for that, right? Are you having a poor diet, high in processed foods? Is your gut inflamed for one reason or another? Do you have food sensitivities? Do you have toxins in your gut, like yeast or bacteria or parasites? So learning more about that and doing testing will help us move forward. There are a few supplements, though, that I think a lot of patients with gut health could benefit from. The first one would be fish oils, and what we know is that fish oils at higher doses, between 4,000 and 6,000, provide an anti-inflammatory effect, so it usually helps to calm down the gut a little bit. The other one that I really like is probiotics. Probiotics are good bacteria, so I think about a good army going in and taking care of all the bad guys in there. So those are the two that I would use a lot to start with.
Yeah, I agree with Melissa that the gut is so important. You know, every day I have patients that are coming in to me giving their symptoms of, my joints hurt, my back's terrible, but then when I talk to them more, they're also fatigued and inflamed and everything hurts. When everything hurts, I can't go just make this knee better. I can't just focus here because everything hurts. So one of the first places we look at is, well, what's happening here in the gut? 80% of our immune system is lying in our bowels. So if you have inflammation or you're eating the wrong foods or had a diet that's been eating, you know, junk food and a lot of processed chemicals through the gut, it's going to damage the gut and create that inflammation. Yeah. Other questions? Great question. Yes. Oh, back row.
I'm postmenopausal by quite a few years, but I'm not on hormone replacement therapy. I'm kind of worried about all the risks. What do you suggest?
It's a good question. Yeah, Melissa, you want to take it?
Sure. So when we think about hormones, the first thing I'd want to know is, what are your symptoms? So some of the symptoms of hormone imbalance would be weight gain, fatigue, mental clarity. Other issues would be poor sleep. I can't stay asleep is what I hear all the time. Mood issues where you're irritable or you're cranky. And then not to mention hot flashes and hot night sweats.
Yes.
Those are the main things we hear.
You know, when I think of hormones too, I think about hormone imbalances, right? So you look great, by the way, for being whatever age you said. But you know, when your hormones are out of balance, what's interesting about menopause, which I'm assuming you're through, is often your estrogen level stays high after menopause because the adipose tissue, the adrenal glands are still making estrogen. But you know what crashes? It's progesterone. It's the yin and the yang. Estrogen makes you feel weight gain. It's a stimulating hormone, risk factors for cancer. Progesterone's that rasta hormone. It calms things down, makes you feel relaxed. It's a diuretic. You lose weight on progesterone, and you sleep like a baby. After I send patients to functional medicine, they come back on their nighttime progesterone. They're sleeping better because progesterone calms things down. And the other thing to take home on hormones is back in 2000, there was a study that showed hormones are dangerous. It's a well-done study, showed women taking hormone replacement therapy had more strokes and blood clots and more cancers. So we're all like, whoa, let's not give hormones to women. But hormone deficiencies are also the big cause of depression, weight gain, arthritis, and everything else. What they did in that study was they looked at synthetic hormones. They looked at like Premarin, progesterones that were synthetic. And those do have a risk of increased blood clots, strokes, cancers as well. So great question and good concern. What we're referring to here are more the bioidentical hormones that your body was used to back when you were vibrant in your 30s, that kept you young, kept your skin tight, decrease your risk of cancer. So we are taking all that into effect, and when you see a good functional medicine doctor or provider, they're going to be looking at your history. Do you have a history of breast cancer? Red flag. They're probably going to pull back and maybe not do some things with you that they would on somebody else. Great question, very pertinent. Anybody else have a question? Yes.
Thank you for taking my question. I have a friend that was suffering from depression, and her functional medicine provider said it was an adrenal issue. What can you tell me about this?
It's good to go. Yeah.
Sure. So our adrenals help us respond to stress. And when our bodies create more stress, or when we're more stressed for one reason or another, the cortisol in our adrenal glands goes up, and then after a while it just gets tired and it piddles out and it drops. And that can create certainly a feeling of depression, but also of fatigue. And so there's a lot of things that we think about associated with the adrenals.
Yeah, all of my patients coming in with chronic pain, they come and say they're apathetic. You look at their faces and it's forlorn, it's withdrawn. That's a sign of their adrenal glands aren't making the hormone cortisol, which gives them energy, it perks them up, it makes them excited, it actually dampens their pain. So we want to look at cortisol, and it's very easy to do. You do either a blood draw or you can look at it via saliva. It gives us some good information on before we help to regenerate their bodies with PRP or stem cell procedures. Let's make sure their body's ready to heal or not too inflamed. And cortisol is something we often check. Yep. Other questions? Yes.
So I'm currently not taking any supplements. What are maybe like the top 3 that you would recommend?
The top three that I really love would be fish oils because of their anti-inflammatory effect on the body, probiotics because of the good army, and then the other one would be just a good multivitamin.
For sure. The only one I'd add too with hormonal patients is fiber. So when we talk about hormones, it's not just the hormone itself, but it's the byproduct downstream that we are finding is causing the cancer. So when you make a nice natural hormone, estrogen for example, in its normal state, it doesn't do anything but help you. But as it goes to the liver, it gets changed to a chemical that's actually going to be harmful. And if your liver can't detoxify and get rid of that byproduct of estrogen, that's where you have the risk of the breast cancer, the weight gains, and the problems. So we often do fiber. On top of the fiber, cruciferous vegetables like broccoli and cauliflower have also been shown to help the liver detoxify the bad hormones. So again, not all hormones are good. We're not like, preaching hormones, everybody needs it. It's actually decreasing some of the ones that are harmful, balancing the ones that are helpful, and that's really what truly functional medicine is. Any other questions? Yep.
I'm thinking about a stem cell treatment for arthritis in my knee. Can you talk about how functional medicine might benefit in that area?
Sure. Yeah, do you want me to take this one? It's a good one. So, I see a lot of males that are coming in as well that want their joints to feel better, they want their back to feel better, and yes, we do talk about going down the stem cell option because it's amazing. It can get your knee feeling better. You'll be running again and jumping high fives, maybe not slam dunking it, but you're going to improve a little bit. The thing is, though, I don't want to do anything with you until you're ready to do that, until your symphony is tuned up and all in sync. So with males, one of the big ones there is low testosterone. So if you're over 45 to 60, you're starting to feel things like fatigue, decreased energy, loss of muscle and bone mass, increased body fat. Even males can have hot flashes. I'm having a hot flash. Guys have that when their hormones drop quickly. Mood swings, depression, those are all signs of low testosterone. One we see a lot in aging men is lack of focus. I just can't think as straight. I just can't think as clear as I could to. Low testosterone could be a problem. So we want to have that checked. We want to look at your thyroid. DHEA is a hormone that leads into testosterone and both cortisol as well. That workup's going to do you well in the long run because then when you come to see me to get your joint regenerative with stem cells, your body's ready to heal. It's got the anabolic effect of the good hormones like testosterone. Your knee takes off and starts to heal after we've planted those seeds of the stem cells. Well, thank you so much, you guys. Those are some really good rounds. I hope you got something from that. But unfortunately, we're out of time and out of time for questions today. So if you want to find out more, I encourage you to check out our website at joelbaumgartnermd.com. Now, when we come back, it's time for that gut check. We're going to do a little questionnaire that'll help you determine where you are now and what the next steps are going to be to a healthy, rejuvenated life. We'll be right back.
If you suffer from chronic pain, Rejuv Medical is here to give you hope.
I was unable to walk much more than a block and a half without very significant right knee pain. Now here I am 6 months later, able to walk 3 miles, and I have full function of my knee, leading a very normal life.
Rejuv Medical has changed the face of healthcare. Through nutrition, fitness, functional, and regenerative medicine, we eliminate pain and stop chronic diseases in their tracks. More at rejuvmedical.com.
Welcome back to HealthOvate. I'm Dr. B, and I want you to experience healthcare the way it should be. We've been talking about functional medicine as an entirely new approach to healthcare, and now it's time for you to do a gut check. We've put together a little questionnaire for you, the audience, but we're also going to put it up for you at home as well to follow along. Let's take a look and see where you are. Okay, the moment of truth. How did you guys do? Anybody answer yes? If you answered yes to more than one of these questions, the only other question I have for you is, who wants to start restoring your health today? Does anybody want to start restoring their health? So what we got to do is we got to put together a little action plan, okay? It's time to start HealthOvating. You've waited long enough, so how do you do that, right? Where do you start? What can you do right now? I'm going to give you some action points that you can take home with you to help you out with this journey. So the first thing, we've talked about it before, but I want to go back to lifestyle changes. Again, we said this is foundational medicine. No matter what you do, this is what you need to do to start changing your health, preventing that stroke and heart attack 10 years down the road. You don't want diabetes, so let's start with this foundational medicine. First thing you need to do is you need to learn how to sleep. The goal of sleep is how many hours? Anybody know? 8 hours of sleep. That is full sleep. Not I'm going to go to bed, at this time and wake up. You got to get 8 full hours of sleep to restore your body. Talking about hormones, right? When we sleep, our body is dumping those good hormones like growth hormone. You can't get enough of that. Testosterone. Those are healing hormones. When we sleep, our body creates that. The next thing you want to do is make sure you're getting enough exercise. So exercise is super important, and it's the right kind of exercise. For most of us that are having hormonal issues, you want to do things that are consistently burning calories. So go for a walk, light cardio, ballroom dance, learn to play bowling. All those things are burning calories and working on your strength at the same time as well. We also want to talk a little bit about resistance training. So studies are showing that people that engage large muscle groups, I'm talking like squats, pull-ups, engaging those large muscle groups tell your body to repair you, right? When it tells your body to repair, what does it dump? Growth hormone and testosterone again. It's not going to make you big and bulky, it's going to make you lean and fit. So large body resistance training is super important. Finally, super important as well is stress management. We talked about the adrenal glands, right? They're constantly putting out this cortisol, but if you're constantly stressed and stimulated, it's always going to be high. You need to learn to relax, to pray, to meditate, to take time for yourself. Create that white space where there's nothing else to do but just be there and just reflect. When you do that, your body's going to respond. So let's all take a big breath today. Exhale. Feels good. You're de-stressing. The last thing that's super important is weight loss. Weight loss affects all of our hormones. So if somebody comes in to see one of our functional medicine practitioners and they have high estrogen, if she doesn't lose her weight, adipose makes estrogen. Adipose in males converts testosterone into estrogen. That's why males and females, when they're 60, 70, 80, they look like twins. You can't tell who's the girl or the boy. The hormones blend it all together, so we've got to get back to our sex-specific hormones. Finally, everybody's asking, what supplementation should I take? One more time, get on some good omega-3s, get on some probiotics. Vitamin D, super important. If you're trying to lose weight, getting enough fiber, whether it's in vegetables or taking a fiber supplement, is super, super important. Well, you guys, that's all the time we have today. Thank you for joining us here in the studio and at home. Our goal is to redefine healthcare by getting to the root cause of disease and degeneration. I hope that today was your first step to restore you. Join us next week. We're going to have an in-depth conversation about regenerative orthopedics. We're going to be talking about stem cells, PRP procedures, which is platelet-rich plasma. So we take the cells from your body whose job is to heal you, we take those back and we guide them into the joint, the spine, the ligament, to get the body to heal itself. I'd love to help you on your journey. So for more information or amazing recipes and help to get you to your goals, go to joelbaumgartnermd.com. Until then, let's all HealthOvate and create healthcare the way it should be. I'm Dr. B, and we'll see you next time.
Thanks for watching HealthOvate with Dr. B. For more information about topics discussed in this episode, go to joelbaumgartnermd.com and join Rejuv University for free. Thanks for watching.